Still with Late Edition, welcome back. Now, as South Africa joined the globe and marked International Nurses Day, while the safety of nurses in the country came under the spotlight following an increase in attacks on nurses. Nurses Union Denosa also called for better efforts to address the shortage of nurses in the country. Well, the day was celebrated countrywide with the main event held at the Pholosong Regional Hospital in Tsakane, out in Ekurhuleni.
Marking International Nurses Day, the day is marked annually on the 12th of May, the birthday of Nurse Florence Nightingale, also known as the Lady with the Lamp.
I will maintain the utmost respect for human life.
International Nurses Day serves to honor nurses and remind communities of the vital role they play globally.
Being a nurse, I think it's giving yourself. It's being compassionate. It's giving your care.
This year's theme, Our Nurses, Our Future. For these nurses, being frontline workers means their profession is more than just work. It's a fight for humanity. But their daily challenges, like a lack of proper resources and support, make their job more difficult.
With our government, what it can assist us with as nurses and doctors, as healthcare workers, they can assist us with human resource, because you can have an infrastructure, but then if you don't have human resource, who's going to take care of those patients?
The impact of the COVID-19 pandemic still weighs heavy on the healthcare sector, and nurses often feel the pinch.
All those people who had comorbidities, other conditions, were kept outside of the facility. And then now we are only seeing the impact after COVID-19 has been lifted. Now all those people who were kept outside are overflowing and they are overloading the system. It is very, very, very heavy and very difficult for the nurses.
Nurses Union Denosa is worried about the impact of the shortages of nurses.
South Africa is experiencing a shortage, Minister, of more than 62,000 nurses currently. Meanwhile, Denosa in provinces has collected the data for unemployed nurses. The data shows that a total of 20,000 nurses are unemployed.
The safety of nurses, another concern.
Some include criminal acts such as robbery, violence act like shooting, like it happened in Tembisa Hospital, where a nurse was killed in the hospital premises. We are collaborating with South African Police Service to increase patrol activities in hotspot areas and during events that are associated with violence.
We want to call upon the community to protect them, because it's really very saddening when from time to time you hear about nurses being harassed. So, some of the incidences, very horrible incidences where nurses are harmed. So indeed, we hold them in very high regard, and we want to pledge that as the people responsible for policy and for health services in the country, we will do everything possible to make sure that their conditions of services are improved.
Often, nurses stretch themselves beyond the call of duty, at times even paying the ultimate price while fighting to save lives. The December Christmas Eve blast in Boksburg serves as a startling reminder of the daily sacrifices by nurses for the betterment of humanity. Patricia Fasagi, SABC News, at the Pholosong Hospital in Tsakane.
Well, for more on this, we're now very pleased to be joined by the CEO of the International Council of Nurses, Mr. Howard Catton. Howard, thank you so much for joining us this evening. Welcome to the show. Look, Howard, the world commemorated and celebrated nurses worldwide yesterday. But in your view, was there really anything to celebrate in light of how these caregivers are almost always sidelines when their duties are done?
Good evening, a pleasure to be with you. Yes, we celebrated and we thanked nurses for the quite incredible and extraordinary service that they gave and continue to give. They carried us through the pandemic. But you're right, it came at an incredible price and toll on their physical health, exhaustion, nurses who are still suffering from long COVID. Tragically, more than 115,000 nurses around the world who paid with their lives. But I'm equally concerned about the mental health impacts on nurses, anxiety, stress, burnout, nurses suffering from post-traumatic stress disorder. And on top of that, nurses who've had abuse from anti-vaxxers, nurses subject to physical attacks, nurses are even unable to renew their tenancies or get childcare because people were worried that they were vectors of the disease as well. The world did not do enough to protect, to support, to invest in its nurses during the pandemic, and that has to change.
Howard, look, I mean, we saw, as you've just rightly mentioned, that of course COVID was a time where they were on the front line, they were absolutely revered, they were taken care of, benefits were added so they could continue risking their lives for the betterment of our sick loved ones. Yet now those perks, along with their dignity, has slowly diminished. Maybe talk to us about some of the challenges that are still inherent, and I'm talking worldwide, not just in South Africa, when it comes to the nursing profession. We've heard about challenges here of work injuries. You also mentioned here mental health impact as well as burnout. But I mean, when it comes to issues of burnout, why burnout when there's nurses graduating every single month that they can, they can be used to try and ensure that, of course, the staff levels are maintained so that the nurses that are currently on duty do get enough rest?
This was the bitter irony of the pandemic. Everywhere around the world, we said during the pandemic, nurses, you are the most important people. You're invaluable to us. But now as we move on from the pandemic, where nurses are saying, we want a pay rise, a fair pay rise. We want decent working conditions. We want protection at work. We want support for flexibility so that we can look after carers and dependents as well. Suddenly, nurses are now being told, oh, we can't afford that. And what we're seeing is that that's now translating into really worrying numbers of nurses who are quitting the profession, who are intending to go, who are saying, I'm done, I've had enough, I've given off my best, but without more support and more protection, I'm out of here. We're looking at a global nursing shortage of in excess of 6 million nurses, made worse by the pandemic. But what the pandemic also taught us is that when our health systems fail, everything else collapses. Our economies fail, our way of life fails as well. So the investment, the support, the protection that we need for nurses and for healthcare workers, it's not just because that is the right thing to do for them. It's also what we absolutely need to do to secure economic growth and security and make sure that we can address future health needs that we're all going to be facing.
And Howard, maybe, I mean, just in closing, how would you encourage these young upcoming nurses that are still in training, that are looking at, of course, how their profession is treated, how their counterparts are being treated? How would you encourage them to continue with the fight to ensure that they do, of course, make it to the end where they are the first call of duty when it comes to healthcare?
Well, look, the first thing that I'd say, and as a nurse as well, nurses in South Africa, around the world, every day, you change lives, you save lives, you make a difference in a way that people never forget. Your humanity in practice, you're part of a nursing profession 28 million strong, and you are the future. Those future health needs that you're facing in South Africa, non-communicable diseases, for example, but aging populations, mental health issues as well, better health prevention and education. This is exactly the work of nurses. We are not going to address all of those health needs and health improvement without our nurses. And we will come together, we are strong, and we will lobby and we will argue and we will advocate for the support and the protection to enable those nurses who are in training now, those nurses who are in the middle of their career as well, to get the support, the protection that they need.
And Howard, maybe in terms of what you've noted, I mean, traveling abroad as well, what have you noticed that seems to be the one glaring difference between, of course, the challenges that is faced by nurses in either third world countries versus the first world countries?
Oh, I mean, investment is a huge issue. It's a huge issue everywhere. But if you don't, we saw, didn't we, in the pandemic, health systems that were collapsing. There wasn't the equipment, there weren't the beds, there wasn't the oxygen, there wasn't the medications, there wasn't the vaccines as well. And when health systems collapse in that way, who are the people who have to look patients in the eye and make decisions about who gets treated or who doesn't? It's nurses, and there's a moral injury that we've seen that comes from that with nurses as well. So investment is key. And the other thing I'd say, leadership. Let's have much more nurses who know and understand the situation on the ground, who understand patients and population health. They need to be at the tables, those top policy and political tables, advising, bringing their expertise to help make sure that we make the right decisions for our nurses and for our health.
Thank you so much, Howard. That was, of course, Mr. Howard Catton. He's the CEO of the International Council of Nurses, and he was talking to us about whether or not enough is being done to improve nurses' lives.